Hi, I'm Dr. Susan Northrup, the FAA's Federal Air Surgeon. You may have seen a lot of focus recently on pilot mental health. I want you to know that the FAA is committed to prioritizing the mental health of pilots. We are doing everything we can to encourage open discussion of these issues and early intervention when necessary. Most conditions, if treated, do not disqualify a pilot from flying. In fact, only about 0.1% of all medical certificate applicants who disclose health issues are final denied. In numerous venues, we have tried to decrease the stigma in the aviation community, just as society grapples with further reducing the stigma surrounding mental health. Through our educational and outreach efforts, we have attempted to dispel the myths. A mental health diagnosis is not a career ender. Any pilot with a substance use problem who achieves satisfactory recovery will get back in the cockpit. And we continue to look for ways to further break down other barriers. We have hired additional mental health professionals to expand our in-house expertise and to decrease wait times for return to fly decisions. We have completed clinical research and amended policy to make it much easier for pilots on a widening number of antidepressants to continue with their careers. We have streamlined the ability for pilots with minor or remote ADHD or ADD, post-traumatic stress disorder, and situational depression or adjustment disorders to obtain an airman medical certificate. We have increased mental health training for aviation medical examiners to enable them to better help pilots. And we make sure to update the checklists and instructions in our Guide for Aviation Medical Examiners each month. Ultimately, though, any discussion about safety and performance must involve open and honest communication. During the periodic medical examination, pilots must disclose all existing physical and psychological conditions and medications. And the aviation medical examiner should follow up on each of these appropriately. There are times when safety dictates that we must disqualify a pilot, but I want to stress that the FAA is working hard to make these cases the exception and not the rule. We have advocated for and been closely involved with pilot peer support programs throughout the industry. We work closely with pilot advocacy groups and universities to develop similar programs for commercial and business aviation as well as general aviation. As with any other medical issue, early treatment for mental health conditions almost always results in a better outcome. We look forward to working together with you on our shared goal of making every flight a safe one. Thank you.